Have you ever thought that ordinary fatigue or a strange cough might actually be your body's way of sounding the alarm? It's not just about getting older. It could be something serious. In this video, we'll go over the top 5 symptoms you shouldn't ignore as you age. And one of them might really surprise you. Watch until the end to find out which one. As we get older, our bodies start to work differently. What used to be no big deal can now signal a problem. Cells regenerate more slowly, your immune system weakens, and symptoms, well, they become sneakier. Many of them seem harmless, but in reality, they could be a cry for help. Knowing what signs to watch for is key to living longer and living well. Now here's a symptom that's easy to shrug off as just part of getting older. Fatigue. You might think, who doesn't feel tired as they age? But here's the catch. If you've slept well, haven't overexerted yourself, and had a normal day, yet still feel completely drained, that's not just everyday tiredness. It's a warning sign. What could it be? Anemia, thyroid issues, early heart failure, or even depression. Yes, it's just as common in older adults as in younger people, only it shows up differently. So, how do you tell dangerous fatigue apart from normal tiredness? If it lasts more than 2 weeks, if you start getting out of breath from a simple walk, if you can't do things that used to be easy, like climbing stairs. Here's a clear example. A 68-year-old woman felt a bit off. She thought it was just her blood pressure acting up, but it turned out her heart was starting to fail, and all because she didn't seek help soon enough. She could have avoided being hospitalized. A little joke with a hint of truth. If you wake up feeling like you've been unloading freight cars, maybe it's not the mattress. One symptom that many people actually see as a welcome bonus, especially after turning 60, is weight loss. Oh, none. But if you're losing weight without trying, no diet changes, no morning jogs, no cutting out sweets, that's not something to celebrate. It's a warning sign. And what could it mean? First off, it might be diabetes. And then an issue with your stomach, intestines, or pancreas. And then sometimes it's a malignant tumour, quietly consuming your body's resources. And sudden weight loss is often one of the earliest signs of cancer in older adults. And then there's also a psychological side to consider. Or sudden loss of appetite can come from depression or anxiety. And then it might look like you just lost your appetite, but underneath, there are serious changes in your mental and emotional health. How do you know when to worry? And if you lose more than 5% of your body weight in a month, or, for example, dropping 3 to 4 kilos without any clear reason or dieting, it's definitely time to pay attention. Here's a real-life example. An 70-year-old man lost nearly 7 kilos in 2 months. And he thought, great, my belly's finally shrinking. But 6 months later, he was diagnosed with stage 2 stomach cancer. Hence, little ironic advice. And if you haven't changed your diet but the weight keeps dropping, be cautiously optimistic. Your body might be celebrating something very different than you think. Here's a symptom that's easy to shrug off as just a bit of blood pressure acting up, or you stood up too fast. Dizziness. One moment your vision darkens, the next it feels like the ground is shifting, and then you're grabbing the wall to keep from falling. Why does this matter? Because in older adults, dizziness isn't just uncomfortable. It can be an early warning sign of serious health issues. For example, blood pressure spikes, poor blood flow to the brain, problems with the inner ear or balance system, and sometimes the start of a stroke or mini-stroke. How do you know it's not just nerves? If dizziness happens often, if it comes with ringing in your ears, unsteady walking, or nausea, if you're afraid to get up quickly because it might hit again, that's not just age catching up, that's a warning sign. Here's a real-life story. A 73-year-old man had been feeling dizzy every morning for weeks. His family said, maybe it's just some ear stuff. Nothing serious. 2 weeks later, he had a mini-stroke. He got treatment in time and recovered, but it could have gone much worse. A little ironic, but with a message. If every time you stand up, you feel like you just got off a spinning ride at the fair, this isn't a carousel you want to hop on. It's a call to see a doctor. Let's talk about memory. And don't just brush it off with well, aging is inevitable. Memory changes and shifts in behaviour can be some of the sneakiest early signs. They creep in quietly, almost without you noticing. And that's what makes them so dangerous. What should raise a red flag? Forgetting where you put your keys? That happens to everyone. But finding your keys in the fridge? That's more concerning. If someone forgets not just facts, but how to use everyday items or gets lost in places they know well, it could be dementia. The tricky part is that these changes often go unnoticed at first. Sometimes it's not the person experiencing it, but their loved ones who pick up on it first. Family might notice that they're more irritable, withdrawn, mixing up words or forgetting important dates. What could be behind this? Alzheimer's disease, vascular dementia, chronic depression, which often hides behind what seems like detachment. Here's an example. A 72-year-old woman started forgetting recipes she'd known her whole life. Then she began mixing up her grandchildren's names. Her diagnosis? Early-stage Alzheimer's. Thanks to early treatment, the progression of the disease slowed down. A little ironic but friendly tip. If you suddenly start calling your cat by your neighbour's name and your neighbour by the cat's, it might be time to get checked out, just to be safe. Here's a symptom that many people just push through for weeks, sometimes even months. A cough. You might think it's nothing. Maybe the air is dry or you've caught a slight cold. But if your cough lasts more than 3 weeks, especially if it's dry or worse at night, that's not just a sore throat. And if you start losing your voice, that's a serious warning. What could it be? Chronic bronchitis? Heart failure? Yes, it can cause cough too. Acid reflux? Or, in the worst case, cancer, lung or throat cancer. The risk goes up a lot if you've smoked in the past. So, how do you know it's time to see a doctor? Cough lasting more than 2 but 3 weeks. Persistent hoarseness. Shortness of breath or chest pain. Or, worst of all, coughing up blood. A real story. A 66-year-old man thought his cough was just left over from a cold. 2 months later, stage 2 cancer. They caught it in time, but part of his lung had to be removed. A quick note. If your cough has become the background noise of your home, like an old fridge humming, this is no joke. It's a sign. This is where things get serious. On their own, these symptoms might not seem alarming, but in older adults, they often signal the very earliest signs of serious health issues. Spotting them early isn't just about feeling better. It can actually save lives. A turning point? Absolutely. Sometimes, saving a life is as simple as seeing a doctor after feeling unusual fatigue. Remember this, ignoring symptoms is risky. It's better to be safe than sorry. Thanks for watching. If you found this helpful, please like, subscribe, and feel free to share your thoughts in the comments. Have you or someone close to you experienced symptoms like these? What was the outcome? Let's talk about it together.